I am super excited to invite into this national conversation Easan Selvan. Thank you so much for coming. We're delighted to have you here. I'm going to sit down with you. We're going to turn on the fire. We'll turn on the fireplace. Hopefully no sparks will fly. And we're going to dive into these important questions, both provocative, intended to be stimulating, and also intended to drill down in questions that I'm sure so many of you are thinking about and likely navigating on a day-to-day basis in your own professional and academic worlds. So Easan, please have a seat.
Thank you so much. Thank you so much for that.
Easan, you represent this wonderful combination of having trained as a Master of Public Health, which is really exciting, and bringing that health equity lens and also the technology applications. And I know as your role in Microsoft that you have a national orientation, that you are understanding how we are utilizing AI systems and how healthcare facilities, how medical schools, perhaps academic public health facilities are utilizing various forms of technology, including Microsoft-driven AI, to ensure that you're advancing population health. Can you tell us a bit about that work first and foremost, and we'll drill down into some of these bigger questions.
It would be my pleasure. So I think I would preface by saying that humbly, I come from a very technical background. I started running high-performance compute clusters for various different research organizations, came out of an academic medical institution, and through working in the community and being charged with working across the country, I will admit that you are all far more expert in the field than I am, but I am privileged to be able to work with so many of your colleagues across the country and bring a national lens to that. As a result of that work, I found it incumbent upon me, in the spirit of responsibility to society, to pursue that master's in public health and to try and understand what drives the system. So what I can tell you is that public health is very different all over the country. Academic medicine is very different all over the country, and it serves the communities that surrounds it. So as we think about artificial intelligence and the fundamental data layers that underlie it, it's important to understand both the opportunities that exist bespoke to the underserved populations in individual areas and sort of the restrictions that prevent people from being able to adopt the most modern technology. Even in places where people have the highest need and the best of intentions, sometimes the resources don't exist. And I think it's very exciting to be here and talking about this because artificial intelligence, among other things, creates additional resources, creates the ability to drive net new impact that didn't exist before if we understand how to harness it correctly. And I would love to discuss with you where the areas are that you think George Mason can apply additional resources, can democratize access to labor and intelligence, and how that can affect the populations that you serve and the populations that your students will serve as they move into the field.
It's fascinating that you begin by saying technology was your first default, your first emphasis, and you wanted to go back to achieve more education and understanding in the population health and in the health equity space. So help us, for those of us among us who will likely be saying, because you understand the concerns and the uncertainty about almost the existential threats that AI poses, what do you say to individuals that say, no, as I understand it, AI is likely to be a driver of inequity. AI is likely to create a greater data divide. AI is likely to marginalize people further. Help us unpack that, help us understand that more from where you sit with both a strong tech as well as a public health and health equity background.
Well, so I guess the first thing that I would say that AI in the media right now is very publicly both lauded and vilified. Depending upon who you're talking to, it's either the solution to all of our problems or something that is imminently going to disrupt society. And I would say to that, AI is relatively non-deterministic. It feeds off of the data and the social constructs of the people that are operating it. And so what is true is that AI is here, and it's being used by all sectors of society. I think one of the things that really drives the urgency of artificial intelligence in public health and in provider space is the fact that payers latched on to artificial intelligence so strongly during the pandemic when everyone else was struggling with a massive public health issue. So it exists. It is a non-moral technology, and whether or not we decide to use it for good or simply recognize the inequities that it has the potential to create, it is incumbent upon the educational institutions of the nation and the world to learn how to apply it, mitigate the things that it is doing to cause injustice, and to promote the equity that is possible through the multiplication of intellectual efforts.
Okay, excellent. I expected that you'd have that kind of perspective, and that's what you're in many ways practicing and seeking to embody. Can you help us position this moment in time? So we often hear that this technological moment is similar to the arrival of the clock or the printing press,
Right.
Or the internet, for that matter. I've sometimes said in the debates among academics about no, I refuse to have my students have access to AI. It's felt to me as though it was that period where faculty used to say, no, students can't use Google.
Right.
Right? I remember how threatening Google
or
was.
calculators, for that matter. And
I wanted students to go to the
math.
library. I didn't want them to forget how to use the Dewey Decimal System. I really didn't. I held on to that. So can you help us contextualize this moment as AI has been likened to these other technological advancements? Do you feel it's similar, or do you think it's something far more seismic?
So I think that all of those moments were seismic in their time and need to be phrased in the context of the society in which they occurred. When you think about things like the steam engine and the advent of national railroads, that was something that was perhaps not democratized in the way that it could be. And a lot of power wound up in a very small number of hands. A lot of interstate laws wound up being created to the benefit of public corporation or private corporations rather than public good. Conversely, and that happened in a time when transportation and the distribution of resources, including food, was critically important. So those are things that you have to consider in terms of being able to do transnational travel. When you consider something like the internet that was developed in an era where communication and real-time information was so critical, that was when I felt like we did very well, in the sense that it was developed by universities. It was developed as a peer-to-peer network that caused the democratization of information and access to net new technology. Now, when we think about the context of the artificial intelligence revolution, to this point, I'm going to assume we're largely talking about the so-called GPT moment.
Sure.
Right? Because I've been working on neural networks since 2012 or so. It's like there's been artificial intelligence for a while. But in the context of this GPT moment, what we're talking about is a society that is more stratified than ever. There's definitely a wider gap between those that have and those that do not. I'd say that you've got an aging demographic where we are going to require more care and more public health than ever before, where we are not going to be able, we currently do not have enough healthcare providers, and that problem is only becoming exacerbated. And so, because artificial intelligence has the potential to multiply labor and more specifically intelligence, to turn intelligence into a commodity and democratize it, I think it's very important in this moment to consider AI as being useful to lessen those inequity gaps, while at the same time democratizing access to intellectual labor, so that it is not just the massive corporations like the Microsofts of the world that are able to benefit from multiplying what they're doing, but so that small departments of public health, so that community-based organizations, and so that individual researchers can do things that are many times what they were previously capable of, without necessarily concentrating all that power in one set of hands. And the only way it's going to get that way is if everyone has access to an education around that information.
Ooh, that's excellent. So those terms are, I think they are profound. I think they're responding to a lot of fear, a lot of fear. Again, as faculty, I can speak to myself that as someone who has spent my entire career teaching people how to think and write, you can imagine how threatening it becomes to recognize that the machine does it better.
Wow.
How did that happen? How did that happen? I've had to grapple with that and have had to accept it. That as soon as GPT started to demonstrate their superiority in constructing the written word, I immediately realized, okay, as an academic, I need to figure out what uniquely I can bring as an educator to this future generation of students. So if you could speak a little bit more to that, just understanding what it means for our current educators, and then we're going to transition more into the obligation that we have to prepare this next generation.
Sure, absolutely. I think what I would say for current and future educators is that AI is here whether you're teaching it or not, whether it is included in your curriculum or not. And there are plenty of wonderful papers where using natural language processing, it's perfectly easy to be able to detect the use of artificial intelligence in even peer-reviewed research papers, right? A lot of this stuff is getting generated automatically whether or not you are teaching how to do that or not. I will say open evidence exists, and our physicians are out there using it in order to make diagnoses. It's involved in a lot of the decisions that we're making on science, and so it's almost a responsibility to educate on artificial intelligence so that you can understand its hallmarks and, if not mitigate, certainly understand its effects on the practice, as opposed to, ban that and have it be something that simply arises organically inside the practice, if that makes sense?
Very much so. It's been a fantastic tension and duality since the arrival of, mass consumption of GPTs. What was that, November 2022, something like that?
And you can watch, like literally in a lot of these papers, you can watch the increase of the M-dash, the increase of the worst use of overly verbose language showing up in the literature and maybe obfuscating some of what we're trying to address as scientists and public health practitioners because we are taking some of these shortcuts. Yeah. And I will admit, simply as a professional, both in the technology and the healthcare space, that it almost becomes a sort of a war of escalation with artificial intelligence. I personally try to use my, meat brain as much as I do the artificial intelligence tools, use them to bring up new ideas, and then use the artificial intelligence to perhaps refine them. But it's almost like when people get access to it incredibly broadly, the amount of work that comes back and forth between people, the amount of emails, the amount of papers that are being generated between people is overwhelming, and it almost necessitates the use of it on both sides.
Okay.
So how do we help people make judicious use of the artificial intelligence in ways that enhance their own opinions as opposed to completely supplanting them? And I guess the other thing that I would say is incumbent on the academic community is there is this theory that artificial intelligence is as good as the amount of data that it's trained on. And up until this point, we had a gold mine of data. As they were running through the initial instantiations of GPT, we ran through PubMed, and we ran through JAMA, and we ran through all of these different sources. At a certain point, we're going to run out of material that human beings have created.
Okay.
And so we'll either have to use synthetic data, which it's not especially well mathematically proven improves any of these models very much, or we'll have to continue generating research data as scientists and practitioners. Like, this is the group that is going to go out and do the research that creates new information that can democratize access to that public health intelligence. And without that net new science, we're going to be stuck in the same place that we have been.
It's going to be a bit circular, isn't it?
In a relatively infinite loop.
Infinite loop. So you've spoken to this, and I'm hearing this message come through, and I was really hoping that we could drill down to it today in the meeting, and that is the opportunity. The back and forth between we are being trampled over by and we are now being disrupted by versus this is an opportunity to harness. And this is my chance to really call out the great work among my colleagues, led by the Association of Schools and Programs in Public Health, who have understood the necessity of being at the forefront of stewardship, of understanding and seizing the moment and recognizing that this is an opportunity to guide, to steward, to make judicious decisions. As this, you've been thinking about this for long before the general population and most of us in academia. As this has unfolded, how have you observed the ability to harness and lead and to leverage and amplify versus to retrench, to resist, and to criticize? How have you observed that?
I mean, I will definitely say that there are institutions that have frozen in the opportunity, frozen in the moment, because of an overabundance of caution and a desire to not deepen inequities that already exist. And certainly, if your data sets aren't representative and or generalizable, there is the very real possibility that the application of artificial intelligence will cause additional problems for already underrepresented populations. That's very important to call out. Responsible artificial intelligence and the use of ethical data sets is absolutely crucial to being able to move forward safely. I understand that completely. I would also suggest that we as human beings have a limited cognitive capacity based on just the number of us and the number of neurons that we have. And there is a tremendous amount of information that exists in the world that is currently going unharnessed. Mm-hmm. So part of what I mentioned in our initial meetings on this is I'm very passionate about interoperability.
Yes, I was hoping you would get to that.
Passionate about data aggregation. And there are data sets that are A, not being explored whatsoever, B, are so woefully out of date or so distinctively transformed that they no longer resemble the original population for which they were expected to cohort, and that have never been examined next to one another in a way that allows the immense power of the AI to make correlations that we would not see as human individuals. So I think that there is the possibility to make very new and very novel discovery around what could drive public health and what could drive health equity by bringing together large data sets in a way they never have before. And I guess the way that I would cap that off is by saying something that we've understood about artificial intelligence and GPTs in general largely is that they have what are called emergent properties. We train them on large sets of data, or to a large extent these days they train themselves on large sets of data, and they learn to do things we never taught them how to do. So early GPTs, we taught how to speak language and they learned math. And that was something that statisticians and machine learning scientists were very surprised by. As we feed more data into these systems and we apply more compute to sets of data that otherwise wouldn't be joined, I wonder how much emergent capability could come out of these healthcare models, public or otherwise, that would revolutionize the way we think about these things, simply because those aren't correlations that the human mind is capable of making in the limited number of neurons that we have. Does that make sense?
Oh, it's super exciting. It's super exciting. I think that for the skeptic, it's always, is this just hype? So I've felt that over different shifts in scientific trends. It felt as though we would move into careful analysis to data, to the generation of more data, to data mining, and then machine-generated data, machine learning. And it felt as though, okay, I was losing control. I used to know how I would collect my data one person at a time, and at a certain point it was just beyond human comprehension. So to hear you talk about those new ways of understanding and associations, it kind of makes me think of the Hubble telescope.
Sure. No, it's definitely, we're exploring new areas of deep space and discovering particles that we never dreamed existed before. But I think also, to extend that metaphor, it allows for individuals who may not have the most expensive telescope in the known world to be able to explore areas that they otherwise wouldn't have access to. I think about the notion, when we talk about democratization, I think about the notion of an agricultural commons, right? Okay. So in the 13 colonies, if you weren't a landowner, you would bring your animal to the commons and they would graze, and that would allow you to develop agriculture. Mm-hmm. So there's something called the idea of an information commons, and that's been very well documented with the University of California. They built a statewide system on their EHR data that was de-identified and pre-approved for IRB for anyone to do research on. So if you're a public health professional and you want to work off 8 million human lives and trillions of data points with regards to drug prescriptions, doctor visits, all that kind of stuff, that's all pre-approved under IRB. That's a democratization of that data space. I wonder if there isn't an intelligence commons that begins existing now, where it's not simply the largest labs with the biggest NIH grants, but we've got these rich data sets and access to relatively cheap compute and intelligence, where any research organization, any single researcher, any community-based organization can discover insights into their communities that would previously be undiscoverable, simply because of the way that we've aggregated that and democratized access to it.
That's an incredibly electrifying vision. That's a very, very exciting vision. I think you've really demonstrated the promise. Even during COVID, I wanted to speak to the privatization of information. And we actually have a library scientist here today that's going to help us. She's going to give a talk on yours, ours, mine, and theirs, to better understand the privatization of data and to better understand the forces at play that can override democratization. So it's refreshing to hear someone who's quite optimistic and bullish in that space, because as you might imagine, there are those that are very fearful that it becomes commodified.
And that is a reasonable concern. You know, we talked immediately prior to this about the potential for the political erasure of data. Data sets that were absolutely crucial to public health simply becoming unavailable, and what effect that has on the public health professionals being trained right now.
Yes.
I've talked extensively about the monetization of data and the desire for a lot of institutions who are now receiving cuts to some of their most crucial programs to fund those gaps using the anonymization and distribution of that data to different locations. So I think it's very important as public health professionals to understand that AI is a tremendous force multiplier in terms of the discipline, but as career-long stewards of data and data sets, it is incumbent upon us to create these information commons so that we can all operate more effectively and have the most impact on society that we possibly can.
I think that's a very profound vision. I think it's really consistent with the values of public health, without question. Back to the point about democratic access and full access to data, tools, and the power of harnessing data. Let's drill down further into skills. So in the tech space, we can get really atomized, if you will. We can get very granular when it comes to data science, data analytics, compute, metrics, quantification, statistics, all of the empirical approaches to information. But in my opening remarks, I also talked about the other most fundamental skills that I think we have an obligation to teach. And that has to do with ethics. That has to do with an orientation toward humanity. It has to do with a understanding of integration, imagination, creativity, and also a investment in the next generation. So if we were designing square one today, if we were designing the college or school of public health for the future, that would be well positioned to harness what's happening in this technological moment, how would we design it? What would be your recommendations?
So I think that many of the same roles that have previously existed in the data space are probably going to continue existing. You're going to have data engineers, you're going to have data scientists, you're going to have data analysts, and those are all specialized skills that individuals will acquire and probably apply as an entire career. I also think that there is the idea that is emergent of a data citizen, by which a artificial intelligence, GPT or otherwise, is capable of filling in some of those skills on behalf of an individual trying to make discoveries inside of a data set.
You believe a GPT could be programmed in that way?
I not just believe, I deploy that on a fairly regular basis. So
Tell us more.
You're still going to need people in order to model your data, in order to interoperate your data, in order to provide access to your data, and in order to secure your data. But the idea of being able to use natural language in order to interoperate with data sets and produce assets that are relevant to your specific population of interest is not new and is fairly well documented. I think about it in terms of, Eric Topol wrote a great book called Deep Medicine probably 6 years ago that I'm sure most of you have read at this point in time, where he postulated that the idea of artificial intelligence could substitute for some of the intelligence and cognition that was necessary in the strict medical load, and create a new career that were people who were healthcare consultants to individual patients. Not necessarily
I haven't read it,
physicians.
but I'm going to now.
I was going to say, it's great. He's one of the leaders in the field. And he postulated the idea of the creation of a career whereby a person was not necessarily an RN or a PA or a providing individual, but someone who was, through the use of artificial intelligence, able to coach individual patients on the things that would keep them most healthy and exist inside of their community. I postulate the notion that while it is critically important that the data science skills and the computer science skills and the statistical techniques that people learn inside of their public health education continue moving forward and frankly advancing, I also think that we are going to apply a whole lot more technical skills to individuals who are out in the field and have expertise in food insecurity or who have expertise in child welfare, who are able to explore those data and make use of them in their practice simply through natural language and the interaction with some of these democratized data sets. And so on the one hand, your question begets the notion of us creating much more elaborate and reliable data hubs, places where our data is curated and understood for its content, its both generalizability and its specific applicability to individual communities. I also think that it is critical that we double down on the soft skills and the community-based skills.
Are you comfortable with that word? I've heard that term used and others push back. They say soft is diminutive. Whereas it seems to be the most powerful prevailing skills needed.
That's an absolutely fair distinction.
We won't get stuck on language, but curious.
I think the essence of what I'm trying to express is it is very hard to be an excellent data scientist and an excellent community advocate at the same time. It is a rare individual that can be effective in both of those spaces. You're not going to find a ton of them, and they're not going to be in every research center. But my colleague, Jim Weinstein, who was the former CEO of Dartmouth Healthcare, postulated recently the notion of a hub and spoke model, whereby there are institutions inside any given geography that are curating this data and exposing data sets to organizations that need to consume them, but perhaps do not have the FTE or the skills from a computer science perspective in-house in order to acquire them. It's been my experience working with many of these community-based organizations that in order to assemble their data set, they have to go to 17 different organizations and do all of these different ETLs to get it into one place.
ETLs being?
I'm sorry, extract, transform, and load. Essentially,
oh, goodness.
the creation of these data sets from various different locations.
I've done that many times, but I didn't know it was an ETL.
So instead of that, what if there's the notion that there is a profession whereby you aggregate data from many different locations and then securely present it to organizations who may not have simply the grant funding to maintain some of these data sets, so that the people who are in these community-based organizations as data citizens can use natural language to explore those cohorts and serve the people that they are tasked to in their communities.
Wow, that's quite a vision. That's obviously would be able to better optimize not only the harnessing of data, but the collaboration to really drill down on solutions to complex problems.
And the other thing that I would propose is that if you're doing that in real time using modern technologies, that data all of a sudden becomes real time. We're not talking about a cohort that was extracted for an individual study. We're talking about being able to not just read the real time information out of EHRs and transport records, but out of market industries, out of so many different modalities of data that, again, we get back to my my comments about new data insights and emergent qualities that we can see in some of these AI solutions, things that we would never have correlated before as individuals.
As someone who, admittedly, confessing, I just published a paper on a data set that was about 25 years old.
Yeah, well, and
I understand exactly what you're saying, and I can see the real benefit and the advantages of that kind of real-time and timeliness of data.
so that leads to the idea, if we can have that timely data, and it's reliable, and we have people that are tasked with curating it, that leads to the idea of the expansion of syndromic surveillance to social groups, to underrepresented populations. So currently with syndromic surveillance, we'll do things like, if there is a wildfire, we'll be able to tell there are this many beds in the area and we need to clear out this much space in emergency departments, do this much work in cardiology departments. I postulate syndromic surveillance for things like food insecurity.
Sure.
Where we can potentially not just react to and create programs for retrospectively some of these social issues, but predict and maybe prevent some of these problems from happening in the zip codes for which we are all responsible.
I think that's absolutely real. I think you're absolutely right. We've seen a tremendous amount of advancement in that space in predicting what was coming using machine learning and analytics. So the ability for AI to be even more proactive and more capable to project and anticipate, I could really see where that would make a huge difference. And goodness knows we need it right at this moment in outbreaks such as measles and Ebola.
And I guess what I would say is organizations that have been that are wealthy enough, that are well-funded enough, the not to call out enormous retailers, but the enormous retailers of the world, the enormous manufacturing companies in the world, you walk into a major big box store, there's a pretty good chance they're going to know exactly what you're there for and be able to stock it and predict it and move it along their supply chain.
Yeah.
And that has been privatized as a result of a lack of access to this end-to-end vision from data scientist to data citizen. That's to circle it all the way back to the beginning, that's the transatlantic railroad model of this industrial revolution.
Yeah.
I'm postulating a model more like the internet, which is democratized, in which there are individuals that are aggregating, organizing, and disseminating data, and individuals that are using it to positively affect the communities in which they reside and for which they are responsible.
Yep.
And if we can work with colleges of public health, if we can work with departments of public health, we can create a future in which community-based organizations have access to the real-time data they need to make a difference in the context of the resources they will have moving forward, as opposed to constantly chasing another grant and maybe having those grants dry up, maybe having those programs dry up, and maybe having those populations go wanting.
Those are all very real realities. That's an incredibly exciting vision, and it really seems as though it would be in our reach. And I hear what you're saying, that the access to consumer behavior has been privatized, but it doesn't have to be so, and it can be used for greater good. It can be used for prevention. It can be used for equity. So that excites me a lot. And so you said, if we can partner, and the answer is, from a George Mason perspective, absolutely. And I know that so many of other of our peer institutions in public health and also healthcare are going to be eager to respond to exactly that promise. So with that, I'm going to end on our big meta question. How's this? Remember, we planned it.
It's true.
When future historians write about this moment, what do you hope they will say public health leaders got right about the AI revolution?
It is my sincere hope that, and I believe you said in 10 years, which is almost epochal for me. It's difficult for me to imagine technology in 10 years, just as much as it's changing in 2 or 3 at this point in time. But as this emerges, it is my sincere hope that public health leaders look back not just at us, but at themselves and their colleagues, and recognize that we were able to come together in a moment of enormous uncertainty, recognize both the threat and the promise of the emerging technology, which in and of itself is without morals, and say that we were able to apply the lens of public health as we've understood it over the course of its entire history to an emergent technology, and not miss out on the opportunity to incorporate it into the practice and the lives of the people that the practice serves.
Well put, very well put. It's a question of, will we allow the future to push us forward, or will we be able to shape it? Fantastic. I really want to thank you for this robust conversation.
I want to thank you for the opportunity.
And thank you for sharing this perspective. And you're a wonderful unicorn in this space, as coming as a very well-skilled technologist, but also a public health advocate.
So in closing, I would like to say, as we go through the day and as you come up with opportunities to think about partnering in this space, this is our passion. This is something that we want to work on, and it starts here in education. And if we can build a program to support the public health discipline of the future in partnership, it would be my sincere pleasure to do so.
Can't wait to get started. Can't wait. Thank you so much.
Likewise.